Trinidad and Tobago, you guys have a special event because not only do you have Dr. Omotola Hope, you have the voice and maybe Dr. Sean Smart on video too. So when Dion asked me to do this, I had to corrupt another colleague of mine to help me with this, and so I'm very grateful that Sean could help me. And you have to know that I'm originally from Guyana, South America, and Sean Smart is originally from Jamaica, West Indies. So we couldn't find a doctor from Trinidad and Tobago. Sorry. So we did the best we could.
A lot of people use epilepsy and seizures interchangeably. What's the difference between the two?
All right, so to get to your first question, Dion, the difference between seizures and epilepsy. It's actually the first question that I answer almost every time I give a lecture or a talk about epilepsy, the difference between seizure and epilepsy. So a seizure is an abnormality, clearly. It's an abnormal event. It's caused by the brain malfunctioning. A bunch of neurons get together and misfire, and the behavior that results from that is what we call a seizure. So sometimes a seizure can be a whole big convulsion, like shaking, and sometimes a seizure can be a staring event where someone is staring and they can't speak to you. So all of those are seizures, and it's caused by abnormal electrical problems in the brain. Now, many problems can cause seizures. So if I had an infection today, a brain infection, if I had a problem with my blood sugar, which affected the sugar in the brain, I can have a seizure. But those problems are easily fixed, and so you can just go in, be diagnosed with that's the problem, and you can fix the sugar, fix the infection, and the seizure is over and you don't have a problem. Versus epilepsy is a chronic problem. It's a condition or a disease where you're vulnerable to have seizures for no other clear reason. It's not a problem where we can easily fix the sugar, fix the infection, and it goes away. So it's a chronic problem. So think about asthma. Somebody has asthma, their lungs don't work in a lot of different situations, and most of the time they do okay, but there are times when they have an asthma attack, an asthma exacerbation, and they need to be treated specially. And so the same with epilepsy. The brain is vulnerable to seizures. It has seizures for no clear reason, and then they have a seizure event, and you have to treat the seizure at the time that they're having it.
Could you explain the different types of seizures and explain if somebody can have multiple different types of seizures?
Yes, there are lots of types of seizures. I would say the main big classification is whether a seizure is generalized, meaning the whole brain is involved in the seizure, or it's focal. There's lots of words out there, and they often are referring to the same problem. So if someone says to you, I had a grand mal seizure, that's a generalized seizure. If someone says to you they had a complex partial seizure, that's a focal seizure. So there's lots of different words out there, but basically there's two big baskets, generalized or focal. That's really it. And generalized seizures, most of them cause you to have shaking, and there's one type of generalized seizure that causes you to stare, called absence seizure. It used to be petit mal. They have lots of names for the same problem. And then focal seizures are very difficult because the manifestations of that are varied. Focal seizures can cause you to stare. Focal seizures can also cause you to have shaking on one side of your body. So the manifestations depend on the part of the brain that's involved in the seizure.
And given the different types of seizures, how do you go about diagnosis seizures, and can the seizures change over time?
Diagnosis, let's talk about that first. There are certainly tests that can be helpful, but when your doctor tells you that you had a seizure or that you have epilepsy, it's usually what we call a clinical diagnosis. A clinical diagnosis means they listen to you very carefully, and they match that up with what they know about how seizures usually present, and they tell you that it's a seizure that you had. So you don't need any other testing to make the diagnosis of seizure or of epilepsy. It's just a matter of having the symptoms, telling your doctor about it, and your doctor understanding enough to know that that is a seizure. It's a clinical diagnosis. Now, there are tests that are helpful, like getting an EEG, an electroencephalogram. We do a lot of that in the United States, maybe too much of it. Dr. Smart and I talk about this all the time. He loves EEG, and he thinks that every single person and every single hospital and every single patient needs to get an EEG, and I disagree, even though I do EEG myself. Another test that it can be helpful is a test called an MRI of the brain or a CAT scan of the brain. These are just ways to look at the brain, to look at the structure of the brain. And these kinds of tests just help us to kind of decide what kind of epilepsy you have and what kind of treatments might be better, but they don't help us to make the diagnosis. The second part of that question was about seizures changing over time. I think seizures can change over time in the sense that they, at certain periods of your life, may be very well controlled, and then over time they may come back or get worse, and so they can change to some degree. But generally, if you have generalized epilepsy or you have focal epilepsy, it's going to stay as generalized epilepsy or focal epilepsy. You shouldn't transition between types like that.
Can you explain some of the popular treatment methods?
So treatments, it's all about medications. So most people will be treated with medication. Typically, we want to see that you have tried at least 2 seizure medications, and those medications were not effective for you. And so that's when we would even begin to think about whether surgery could be an option. Of course, in order to have surgery, you have to have a focal type of epilepsy. You can't have a generalized epilepsy. So there's some testing that would have to be done to confirm that. And the types of surgeries that can be done, I would say there are 2 main types. One type is just going in and resecting the brain with a knife, based on where we think the seizures are coming from. And we're now able to also do laser resective surgery, where that kind of the brain is removed with a laser.
What are some of the long-term side effects, common side effects of anti-seizure drugs, understanding that each seizure drug may have different side effects?
I would say probably the most important long-term side effects of the seizure medications that you guys have available to you in Trinidad and Tobago are a couple things. One is the effect on the liver. So most of those medications, essentially they're like taking a little bit of alcohol every day. So you're giving your liver extra heavy lifting to do every day. And perhaps another important problem might be something where your bone density, you have a higher risk of fractures and falls because your bone density is not as good.
What are some of the biggest misconceptions you see out there when it comes to epilepsy and seizures?
Well, the biggest misconceptions is that everybody with epilepsy has intellectual disability, right? So there's a big misconception that if you have epilepsy, it means that you are not normal in your thinking, that you can't go to school, you can't become a lawyer, you can't become a medical doctor. That's a big misconception. I think one of the reasons that this misconception occurs is that epilepsy is many different diseases. So some people with epilepsy do have problems with thinking and being able to learn, and other people with epilepsy are completely normal. So it just depends on the type of epilepsy you have and why you have epilepsy.
Is one of those individuals the Chief Justice of the Supreme Court?
That's right. Chief Justice Roberts in the United States has epilepsy, and he had a breakthrough seizure, I don't know, maybe 3-4 years ago. And so this is just an example of a high-ranking lawyer that has epilepsy. There are people that are athletes. In every medical school class, there's probably 1 or 2 people that have epilepsy. I have students that are, I have dental students and master students and like a whole range of patients. And of course, I have patients too who, really are dependent on their family to take care of them.
What are some of the common mistakes people living with epilepsy make, and how would you help them fix those errors?
I think the biggest mistake people with epilepsy make is to think that they can't manage their seizures themselves. They don't think that they have the power to really prevent most of their seizures. I think for a good percentage of people, getting their medications every day, getting enough sleep, managing their stress is all they really need to manage their life and to live a full life with epilepsy. So I think if we can encourage more people to do that, to actually be in charge of their care, so to speak, then I think that would help a lot.
How do you help people get the support to be in charge of their care, and are you satisfied with the supports that are out there for people with epilepsy?
I think we can do much better. I think it varies depending on the community that you live in. how much stigma there is and whether there is support for people with epilepsy. But across the board, we can do a lot better.
How do you break the stigma? How would you recommend breaking the stigma associated with epilepsy?
Education, education, education. You gotta educate people about what it is. It's a brain disorder. It's caused by, just like any other illness, like high blood pressure, diabetes, asthma. We understand a lot about it. We understand what's going on in the brain during a seizure. We know how to treat it. It's not when you have the devil that takes over your functioning. It's not bad spirits. It's not that you drank the evil water. It's not any of those things. It's just a brain disorder. That's all it is. So I think if we can educate more people about epilepsy and about the brain in general, I think there's going to be a lot of demystification of epilepsy.
And do you believe that education can also help integrate with people at work and school to get rid of some of that stigma in those situations?
Yeah, absolutely, at all levels. I think if say a teacher has epilepsy and she can make a lesson about epilepsy with her children in school, if she has a class, she can make the fact that she has epilepsy a health lesson. And if there are nurses out there that are teaching other nurses, and if they're at every level, whether in school, at workplaces, everywhere, I think if we have more education about it, I think people will understand the disease a lot more. There'll be less stigma about it.